Hello, everyone. So first of all, I would like to thank the organizer for inviting me to speak at this session. So today I'm going to talk about the key population-led health services to combat transgender stigma. And so my next slide will show you the estimated number of the transgender populations in Asia and the Pacific countries. So it was estimated that there were around almost 10 million of transgender people living in our region, which is include Asia and the Pacific countries. And as we all know, transgender individuals, they are facing multiple marginalized vulnerabilities, which include family rejection and domestic violence regarding their gender identity. They're also facing bullying in school, and it was resulted in lacking of education. It also includes physical and sexual violence, unequal employment opportunities, and institutionalized stigma and discrimination. And in terms of health disparities, one of the alarming issues among the transgender health community is about the access to safe hormone use and other gender-affirming surgery, HIV and other sexually transmitted infections, mental health and substance use remaining challenging in terms of health issues among the transgender individuals in our region. So in terms of HIV prevalence, it was estimated that high HIV prevalence was observed in certain cities and geographic locations in our region. You can see on this slide, it was actually the data from the UNAIDS. It actually showed the data of the high HIV prevalence among the transgender people in certain cities of our region. It was actually ranging from 1% to 34% in some certain countries in the region. So, and in terms of Thailand, let me share with you the data from my country's Thailand. It was estimated that there were around 300,000 of transgender women living in the country. And of those, 60,000 of them, they were sexually active. And of those who were sexually active, 13,000 of them, they were at high risk of the HIV acquisition. And in terms of HIV prevalence among the transgender women in Thailand, it was around 17% in 2018. And in terms of stigma and discrimination in healthcare settings in Thailand, this data show you from the two studies. The first study showed you that almost half of the transgender respondents in the study, they said that they never received advice and counseling from healthcare providers on gender-affirming care and hormone use. Almost half also reported that they had negative experience from healthcare providers, especially from public health facilities. And another study showed that 15% of healthcare workers, they thought that HIV positive transgender women should be ashamed and blamed. It was actually showed you the stigma related to transgender identity and HIV status. So at the Institute of HIV Research and Innovation where I come from, we actually develop the key population-led health services or KPLHS approach to fill the service gap for key populations, including transgender populations. So we actually integrate 3 A's and 1 Q into the KPLHS approach. So the first A is accessibility. So the KPLHS approach should be actually located in hotspots or where the key populations or transgender people, they're actually living in. And the services provided to key population should be flexible and suitable for the key population lifestyle. And the service provided or offered should be one-stop or comprehensive services. And in terms of the availability, the services offered should be needs-based and client-centered. For example, if you're working for and with transgender populations, one of the health concerns or issues that transgender people are often demanding for is actually about the hormone level monitoring and gender affirming surgery. So the service should be tailored and provided to meet with the specific needs of the transgender population. And it's also similar to sex worker. If you're working with sex worker communities, the service need to be catering and responding for the legal consultation. And in terms of acceptability, staff actually need to be coming from members of the key populations community, because they actually understand the KP lifestyle, and the service provided need to be gender sensitive and KP friendly in order to be free from stigma and discrimination. And the last one is about the quality. The service provided need to meet the quality, and the staff providing need to be trained and qualified in accordance with national standard, and establish strong linkages with and high acceptance from public health sectors. So in summary, the key population-led health services need to be designed and co-delivered by key populations themselves, and it's actually responding to the needs and the specific health needs of the key populations. And in this picture, it's actually come from the swing service worker in group foundations, where the trained key lay provider providing the health services to the key population that they're coming from. So, and in terms of transgender healthcare setting, we at the IHRI, we organized the first transgender community consultation in order to meet the specific health needs of the transgender population due to the high HIV prevalence among the transgender women in Thailand in 2015. So we actually invited the representative from the transgender community, and they represented transgender youth, transgender sex worker, transgender living with HIV, transgender men, as those who are coming from the transgender celebrities. We actually asked them what kind of health services they really need, and what kind of transgender specific clinic that they wanted to see in their dream. And based on this consultation, we actually came up with the agreement of having a dedicated transgender specific health clinic. And the name of the transgender specific health clinic is actually was nominated and chosen. And we actually came to the name of the transgender specific health clinic for transgender people, that, which is the name as Tangerine Community Health Clinic, which is currently located at the Thai Red Cross AIDS Research Center right now. In this picture, you can see that the transgender counselor, she has been trained to provide the PrEP dispensing to the transgender client at the Tangerine Clinic. So the Tangerine Clinic is actually transgender-led and gender sensitive, which is offer gender affirming hormone treatment into the sexual health services. And one of the approach that we are using to and led by the transgender community is the way that we recruit the transgender clients to come to use the services at our clinic. It's actually the transgender-led online outreach strategies. We actually, at the Tangerine Clinic, we don't have the traditional outreach team to go out and to knock the door and to provide the knowledge and information to the transgender community. We actually use the online platform, which is mainly Facebook page, to draw the health demand and to increase the access to the transgender clients to come to use the services at the clinic in Bangkok. So here are some of the transgender social media influencers that we are working closely with them, and we call them as the friends of the Tangerine Clinic. They came to use the services at the Tangerine Clinic, and they help us to promote the health services and how to show that how our healthcare providers are gender sensitive, and the quality of the service meet their standard and their expectation. So here are the data of the Tangerine Clinic's performance as of March this year. You can see that in the orange color column, that you can see that the Tangerine Clinic actually cater the services or provide the health services to more than 3,500 transgender individuals. And of those, 95 of them, they are transgender women. And you can see that on the HIV testing uptake, it was very high among the transgender women client. It was actually 95%. And we also found 10% of those who were tested HIV positive. However, we are able to link those who were tested positive to initiate the ART. So most of them who initiated ART at the Tangerine Clinic, they were initiate ART through the same day ART program. Which is when we found that they were eligible to initiate. So we are able to initiate ART on the same day of the diagnosis if they are eligible. So in terms of syphilis testing, we also had high HIV syphilis testing uptake, and we found that 11% of them, they were tested syphilis reactive. However, we found it very difficult to increase PrEP uptake among these transgender women population, we had only 13% of transgender women had received PrEP at the Tangerine clinic. So, and this slide shows you the demographic characteristic and risk behavior of the transgender women client accessing the services at the Tangerine clinic. The median age of the transgender women client at the Tangerine clinic was 26 years old. We found that more than half of them, they had below bachelor's degree education. Almost 30% they were unemployed, and 16% they reported engaging in sex work, and almost 10% they reported using amphetamine type stimulants. In terms of sexual and gender-based violence among transgender clients at the Tangerine clinic, we found that 24% of them, they were bullied by their classmates. 11% they reported that they were physically abused, mostly by their strangers and by their neighbors. 8% they were sexually coerced, and mostly happened by their colleagues and by siblings. Almost half they felt rejected due to their gender identity. And 16% they experienced public shame due to their gender identity. And as I told you before, the PrEP uptake among transgender women in Thailand was very low. And at the key population-led PrEP service is actually mainly serving MSM population. You can see on your left-hand side that the proportion of the PrEP users in Thailand among the transgender women was only almost 14%. And on your right-hand side, you can see that more than half or 60% of the transgender women in the survey, they said that they don't know about PrEP, and only 7% they reported that they were using PrEP at that time. So we found that it's about the awareness of the PrEP and knowledge, as well as the access into the PrEP services among the transgender women in Thailand remain a challenging and concern. So we at the Tangerine Clinic, together with other collaborating partners, we also received the funding from USAID PEPFAR and Linkages project. We also work closely with the Ministry of Public Health and Bangkok Metropolitan Administration to launch the first national transgender specific PrEP campaign. This campaign called PrEP in the City, and the campaigns actually feature 4 different characters of the transgender social media influencer. We actually launched this campaign 1 week ago before I talk at this session. So we aim to increase the PrEP awareness among the transgender women in the country, and we actually anticipate to see the high PrEP uptake among these populations as well. And we found that we trying to emphasize on the gain framing messages into PrEP, and rather than inhibiting the messages around risk behavior, because we found that when you communicate about negative risk behavior among this population, is not going to helpful for them to raise their awareness in terms of access to PrEP uptake. So we will see and evaluate the impact of this campaign in the next quarter. So, and as we are living in the COVID-19 outbreak, so a few months ago, the Tangerine Clinic team, we rapidly developed the standard operating procedures in terms of self-sampling collection for chlamydia and gonorrhea among the transgender women client, while we wanted to practice social distancing policy, and we wanted to ensure continue access to the health services at the Tangerine Clinic. So we trying to launch the self-sampling collection for the first place at the Tangerine Clinic, and we found that so far we had 170 transgender women clients conducted self-sampling collection for chlamydia and gonorrhea. And you can see the data here that we had 100% acceptability for urine and oropharyngeal collection, almost 100% for anal collection, and 88% for neovaginal collection among those who have undergone genital surgery. And we also found high testing result, which was 33% of those who collected sample self-sampling collection, they were tested positive for chlamydia and gonorrhea. We also found that 96% of them, they were tested positive from anal and oropharyngeal compartment. And when we're asking about their satisfaction and their feeling when conducting self-sampling collection, we found that 75 of them, they found self-sampling to be simple and empowered. So the self-sampling collection can be a new normal after the COVID-19 outbreak, and the transgender clients, they can feel empowered to control their own health in terms of accessing to the sexual health services at the clinic. So in conclusion, I want to summarize here that transgender competent care is key to mitigate stigma and discrimination in healthcare setting, and it's also increased access to sexual health and HIV services among the transgender population as well. And key population-led health services here in this setting is the transgender-led health services approach is actually contribute significantly to the HIV response in Thailand. And the key messages of this presentation is that if you give the community the tools, they will help you finish the job. In this case, they will help you finish or accelerate and end to the AIDS epidemic in the country. And thank you very much. And that's the end of my slide. Thank you very much for your attention.